Hi, and welcome to another episode of Rotator Cuff Expert. Today we're going to talk about how diabetes affects rotator cuff tears and how more importantly, how it affects rotator cuff repairs and re-tears. So there's a study that actually is just coming out. So if you're watching this in February of 2023, this study just came out by Kim et al. From the Journal of Arthroscopy, and it looks at the level of hemoglobin A1c and the risk of re-tear. Let's backtrack a little bit. So diabetes, what is diabetes? So diabetes is your body's ability to use glucose or get glucose into the cells. So if we have type 1 diabetes usually is an autoimmune function where the body attacks the pancreas, a specific part of the pancreas of the beta cells, and those beta cells are what creates insulin. So when insulin goes out, insulin opens up the gates in the cells, so to speak, for the glucose to go in. So if you have type 1 diabetes, you don't have insulin. If you don't have insulin, you don't open up those gates. If you don't open up those gates, then the blood sugar goes up because it's circulating the sugar. It's not able to get into the cells. That's why people who have type 1 diabetes have to have insulin, because it opens up those cells. So you take insulin, okay? So that's type 1. Type 2 is usually in a later age group where it's not that the pancreas doesn't make insulin. It may make not enough insulin, so it might be a minimal amount of insulin, but there's still some produced, or that the cells are resistant to that insulin, which means the insulin is around, but it's not in such a quantity that the cells don't respond to it like a normal cell. And so that normal response of opening of the pathway up to get the glucose in is inhibited, so it's not as good. So you have to give either some medicines to help get that transferred in. There's a bunch of different medicines. It's too complicated to go in here. This is beyond the scope of our talk today. If you have not enough insulin, or you have cells that are resistant to insulin, then you're going to have increased blood sugar, right? And that's what we check, blood sugar. And so if you have increased blood sugar over time, then we're going to have increased hemoglobin A1c. So what's hemoglobin A1c? So hemoglobin is the red blood cells, floating around in your blood. If there's enough glucose in your blood, it affects the hemoglobin, and it glycosylates part of the hemoglobin molecule, which means it puts a little sugar-like molecule on the hemoglobin, and that's what's hemoglobin A1c. So the two measures of blood sugar is, one is you can just prick your finger, take your blood sugar, right? That's one way, and that's an immediate. That's right where your blood sugar is right now. The other way is a hemoglobin A1c, which is they look at hemoglobin A1c specifically, and hemoglobin A1c is like looking at what the average of your blood sugar is over a 2 or 3 month period, right? Okay, so if you have a hemoglobin A1c of 4, which is a good hemoglobin A1c number, would say the average blood sugar around over the last 2 to 3 months is 68, which is a good number. If your hemoglobin A1c is 10, that means average, not all the time, but the average blood sugar over that 2 to 3 month period is 240, which is not a good number, right? We want to be somewhere in the low 100s or so, depending on a lot of factors, but in general. So hemoglobin A1c tells us how good the control of blood sugar is, not today, but how good it has been for the last 2 to 3 months. So Kim and his fellow researchers looked at this, and what they looked at is that if we look at the hemoglobin A1c before surgery and the hemoglobin A1c 2 to 3 months after surgery, we look at those numbers. If that number has increased, which means essentially that someone has had poor blood glucose control in the beginning of the healing of the rotator cuff, right? So if we have a 7 hemoglobin A1c before surgery, and we have an 8 hemoglobin A1c after surgery, that's an elevation of hemoglobin A1c, which means the blood glucose has not been in good and tight control for the beginning of the healing process, or the healing process of 2 to 3 months. And what they found is if you have that elevation from before to after, then you have a 51% chance of re-tear, 51%. And if you don't, you have a 14% chance of re-tear. So there's a chance of re-tear no matter what. And we know that because we've seen it over and time again. But the difference between 51% re-tear and 14% re-tear is significant. So that tells us people who have diabetes, whether it's type 1 or type 2 diabetes, they have to really be careful in the recovery time. They have to be really careful maintaining that blood sugar in those first 2 to 3 months, because If they are not, they have half the people who are not careful with the blood sugars are going to have a re-tear. That's bad, right? And everyone knows that it's hard to get through a rotator cuff tear and a rotator cuff repair. And if we can do something to minimize the amount of re-tear, that's super important. So this is something that I'm going to be really trying to pay attention to and talking to my pre-op and post-op patients, because 51% re-tear, that's a lot of re-tears. That's a lot of more work that person has to go through. That's a life-changing event. I mean, it's bad enough for 3 months, but you got to do it all over again. And if your blood sugars are not good again, then you have another half chance of re-tearing it again. So key thing and for us is control your diabetes for lots and lots of reasons, right? But if we can control the diabetes early on after repair, it will affect how the body heals. And if the body is inhibited, is distracted from doing a proper repair, in that window, we'll have a re-tear. If we can control that blood sugar and keep it where it was, then we have a much less chance of re-tear. So thanks for listening. Interesting topic. Please subscribe to the channel. Any topics or comments, I appreciate, well, most of the comments I appreciate. A couple of them I don't really appreciate, actually, but that's beside the point. Please leave comments. If you have anything else you'd like us to talk about, I'd be happy to. Thanks.